Simon Ateba from Today News Africa. Simon, please unmute yourself.
Thank you for taking my question. This is Simon Ateba with Today News Africa in Washington, D.C. President Biden said days ago the U.S. has millions of doses of AstraZeneca vaccine that have not been used. Is the WHO in talks with President Biden to send those vaccines to COVAX? And talking about COVAX, the WHO said recently the COVAX facility was still in need of over $20 billion to provide enough vaccination to most people in the world and begin to crush the coronavirus. How much money is still needed now? I know President Biden has already pledged $4 billion to WHO and COVAX, but clearly the money is not enough, and the US has more than enough money to provide the $20 billion left if the WHO in talk with President Biden for additional financial contribution. And has the WHO received the first pledge from President Biden? And how significant has that contribution been so far? Thank you.
Simon, thank you very much. We have a rule of one question only. These were about 10. I lost counting. But let me hand over to Dr. Aylward, please.
Thank you, Christian. Thank you very much, Simon. They were all good questions. So first and foremost, on the issue of donations, indeed, and what we refer to as dose sharing, indeed, we're in discussions with all countries that have access to substantial doses of WHO emergency use listed vaccines for sharing of doses and donations of doses to the COVAX facility so that we can ensure all countries can get started and all countries can sustain vaccination, especially of healthcare workers and especially of their older populations. And so we have been in discussions since December. If you go back and have a look, you'll see that in December, we established the dose sharing principles for working with COVAX to ensure that high quality doses of vaccines can get out to all countries equitably through the COVAX facility. And since that time, we've been in discussion with many countries, the US, the EC, Canada, the UK, and others, Australia, New Zealand, about sharing of doses to through the COVAX facility. A lot of positive interest across countries to do that, balancing, of course, also their own domestic needs. But as you heard from the Director General in his opening comments, we are at a particularly crucial point right now in the rollout of doses globally, and are encouraging any country that can help to do so. We're encouraging, though, and I want to highlight this, not just the countries that have access to doses today or have contracts with the suppliers, but we're also calling on the suppliers to help as well. Because as many of you will understand, there's contracts established with countries for their doses, but those countries may say, okay, we want to donate those doses to COVAX, but we need the help of the suppliers as well to take those contracts, adapt those contracts with Gavi and with COVAX and with the countries involved very, very rapidly, not over weeks and months, but over days and hours, to be able to ensure doses can be redirected to help in places that really need them and need them urgently to begin the rollout, the equitable rollout. So it's not just countries, Simon, we're also calling on the companies as well to work with us on this as rapidly as possible. And in terms of the financing, we do need over $20 billion, $22 billion, but that's for the entire Act A agenda, or the Act Accelerator agenda, to ensure the equitable distribution of vaccines, oxygen, dexamethasone, PPE, and diagnostics. As the Director General, Mike and Maria affirm all the time, countries need that whole package to control the disease, protect their health systems, health workers, and populations, and get their economies going again. So that's for that whole package. Within the Act Accelerator, one of the best financed aspects are the COVAX facility, rather. But we still do have an urgent $2.3 billion gap in the needs to be able to procure and close some of the deals that we have to be able to secure as much vaccine as is available this year for low and low middle income countries in particular.